Dr. Tommy, I have this mom on the phone. She's telling me her 6-year-old son has shark teeth. She sounds very concerned. What should I tell her? Better?
Welcome back to Tooth Talk with Tommy. If this is your first time visiting my channel, thank you so much for stopping by. My name is Dr. Tommy Lee and I'm a board-certified pediatric dentist. In this channel, I give out helpful dental tips for parents and children so we can help you maintain your child's beautiful smile. If you have not done so already, please consider subscribing to this channel so you can get updated on our weekly dental tips. So if you have watched my previous episodes, you might have noticed that the background looks a little different. If you haven't noticed anything, no worries, I won't get offended. We are actually recording this episode in our office today. For those of you who are not familiar, our office is located in Montvale, New Jersey, and you can find the detailed information of our office in the description below. If you live near the area, you should definitely stop by sometimes and say hello. We have a really cool espresso machine and I'll give you some free coffee, guys. Anyways, so for the past few weeks, due to COVID-19, our office had been closed based on the state's recommendation. And we are very excited to finally reopen again. So let me give you a quick tour of our office. So, does the story in the beginning of this episode sound familiar? By the way, that was my assistant Genesis. She did a pretty good job, right? She practiced for a few days for her line and it only took her 13 trials and 3 days to record it. It usually takes me much more than that. Anyways, are you concerned that your child has 2 rows of front teeth like this? In this video, we'll learn everything about the double rows of the front teeth and what we need to do about them. So, when does your child get their first adult tooth? Typically, the first adult teeth your child will get is the 2 bottom front teeth, and we call them mandibular central incisors. These teeth usually start erupting around age 6 or 7 years old, and during this time, your child might also get their first adult molar teeth all the way in the back. We call them first permanent molars or 6-year molars. As the 2 bottom front teeth are coming in, they're supposed to dissolve the roots of the baby front teeth, what we call primary mandibular central incisors, who are sitting right above the adult teeth. As the roots dissolve, these baby teeth will become more wiggly and eventually fall out on their own, and the tooth fairy will pick them up. But sometimes, the permanent central incisors, aka the adult front teeth, might start popping in behind the baby front teeth. And this can cause a lot of anxiety to the parents. Well, if you're one of these parents, don't worry. Usually, as the baby teeth fall out, the adult teeth will start moving towards their correct position. But there are some exceptions, and if this happens, you should bring your child to the dentist for more evaluation. So let's learn more about them. The first case is the permanent central incisors are about halfway erupted and the child's baby teeth still have not fall out or not even wiggly at all. Then your child's dentist might have to take out the baby front teeth because more these adult front teeth are in, less chance they will move towards the correct position on their own. And the second case is some children might not just have enough space for their adult teeth and their teeth look pretty crowded. If you see something like this, then you should also consult with your child's dentist and your child might need orthodontic treatment such as braces. And last, if you're not sure whether your child has enough space or not for their adult teeth, and you're worried because you don't know what to do, it's always a good idea to visit your child's dentist for consultation so they can evaluate and tell you what needs to be done. So here's the question of the day. When did you lose your first tooth, and what did the tooth fairy give you for your first baby tooth? As always, if you have any question or any topics you want me to go over, please write them in the comments. Thank you so much for watching my video today, and we'll see you guys next week.